welcome back to part 2 of Gemma's period health taboo talks. So guys, in the first video we talked about why we have periods, when, what is the reason, and I hope that you're able to get something from that. In this video we're going to be talking about issues that are related now to having your period, and I am going to be reading from my notes a lot in this, guys, because there's lots of stuff that I need to cover in this, so I do apologize if I look down because that's how I'm reading my notes. I think this is a really interesting subject to cover, because when you're having your period, if you're not used to it or someone hasn't discussed these issues with you, you may think there's something really wrong with you, when actually it could be quite normal. So there are topics that I'm going to go through that are common ones, and there's some not common ones. So again, by the end of this video, I hope that you learn something, and is there anything that's missing from this, please hit me up in the comment section below. And then I can do some, like I keep saying, some mini videos, and we can get the right subject matter covered for you. So the first subject that we're going to talk about is PMS, so premenstrual syndrome, or PMT, premenstrual tension. So what causes these are changes in the body's hormonal levels before your period starts. This can cause physical and emotional changes within your body. Not everybody is going to experience PMS or PMT, but if you are experiencing it, the most common symptoms that you're going to experience are mood swings, feeling upset, having really bad anxiety, you can be irritable, you can have tiredness, but you can also have trouble sleeping, you can have bloated pain in your belly, you can get really bad breast tenderness, you can get headaches, your skin can become more spotty, you can get greasy hair, you can get changes in your appetite, and even in changes in the frequencies that you want to have sex. So things that can help this naturally are regular exercise, eating a healthy balanced diet. It's got here about having plenty of sleep, but if you're someone that's having trouble falling asleep, there are herbal medications out there that are really good, that are not as potent as obviously the doctor's medications for sleeping, but can help relax you. I naturally am really bad at falling asleep and staying asleep, so I use actually something on YouTube to meditate to sleep, and I've also used sleep hypnosis before, so that's also something really interesting to try, but I guarantee I fall asleep and I snore and I'm loud when I do that, so give it a go. So again, yoga and meditation comes up. And then if you're someone that is experiencing a lot of pain, you can use over-the-counter painkillers such as paracetamol and ibuprofen. If you are someone that has issues with their kidneys, ulcers, then do not use ibuprofen. You can use some paracetamol. A hot water bottle can also be really useful when you've got an aching back, a lavender pillar. Also having a nice warm bath. If you're obviously when you're on your period, some women don't like having baths, so if you're someone that doesn't mind having a bath, then having a nice warm bath can also be a real just help naturally, but also a nice warm shower as well with the twinkling of the water can also really help. So guys, I thought it was really important to obviously tell you when you should see a GP with these things as well. So when you should be seeing a GP is if everything else you have tried has not helped, or if the symptoms are now affecting your daily lifestyle. When you see your GP, they can give you some medication, as we've discussed. There are hormonal medications, and this is normally the pill that they will put you on. They'll put you on the combined contraception pill. There are some people that have such bad anxiety, that they can go and have cognitive behavioural therapy, and that'll be sitting down and talking with a therapist and just seeing if there's any ways that person can help them get through these difficult times for them. And also in some extreme cases, some of our people do need to take antidepressants to make them feel okay, and this might be a long-term thing, this might be, and normally when you're on hormone balancing medication, you don't really need antidepressants, but sometimes that hormone imbalance is such a big massive thing the antidepressants just help also balance the way the person feels. Okay, and this all stems from hormonal levels changing within the body, and this is something that, you know, men joke about a lot, and they joke about, oh, she's on her period, she's moody and things like that. And I think it's really interesting that when I've spoken to people about this, they even say now that their partners don't understand it and don't get it. So I think, you know, education for boys is really important, and this is something that I've done a lot with my son, is try and explain to him that it isn't easy having a period. It's horrible sometimes. It makes you feel absolutely terrible. So I don't think that's a bad thing to try and talk to our younger generation of males, to try and get them to sympathise or even understand what we go through. And I'm very lucky. And again, in video 3, you'll hear a lot about his understanding of me and women. So, changes in your period. So some people's periods at times may change, and that might be completely normal for them. And what I mean by that is that their periods might be longer, they might be shorter, they might be heavier, they might be lighter, and that might be completely normal for that person, and there's nothing to worry about. People that take contraception, so the hormonal contraceptions, can really change your period pattern. So taking hormonal contraception can cause massive changes within your period cycle. For some people, it causes them to have no periods. Others, it causes them to have irregular periods. Sometimes it is completely sporadic. You might not have one for 6 months. So, you know, you might not have one at all. So if you're someone that needs to have a period just to have validation that you are still having periods, because a lot of ladies do actually want to see that they bleed every month, then the best thing to do is talk to your GP or family planning advisor about what contraception will be best for you, because the contraception that you're currently on may not be the best one. I am looking to do a video on contraception and how that affects people differently. So if you are interested in that, again, please let me know down below and I can start working on those type of videos as well. It is important that, again, when would you go and see your GP if your period had changed? So if you start bleeding in between periods, if you bleed after sex, or if you're someone that's had your menopause and then you start bleeding after that, it's really, really important that you do have a chat with your GP about this. There can be some very simple reasons that we have this bleeding outside of our periods, and that can be an infection. It can be an abnormality in the neck of the womb, so at the cervix. And in the really rare case, it also could be a cancer. So this is why, again, another subject that I would really like to cover is smear testing and smears. So girls, if you're at that age where you should be having smear tests, make sure that you are having your smears. It is really, really important. And again, this is something that affects us massively. We need to make sure that we are having our smear tests and we are looking after ourselves. So pregnancy, I'm going to say it, pregnancy can change your flow. If you have missed a period, please do a pregnancy test. You might not be pregnant, but if you've had sex and there is a risk that you could be pregnant, that could answer all your questions right there. You might be pregnant. So please do a pregnancy test. Okay guys, this is a massive one, and a lot of women will experience this one. So painful periods. So pain is really common during your period, and it is your uterus contracting and expelling the tissue, the blood, the clots. And that contraction is the muscle basically squeezing, and it can be painful. And for some women, it can be very painful. There is evidence that exercise is really good with this type of pain and can help relieve it. Over-the-counter painkillers, again, are really good. So you can use paracetamol and ibuprofen. Again, obviously there are risks if you are someone that's got asthma, or if you've got ulcers or any other conditions that you shouldn't take ibuprofen with, please don't take ibuprofen. Some hormonal contraceptions are really good at reducing pain as well. So again, this is something that your GP may discuss with you, or your family planning advisor may discuss with you. So when do you need to see your GP? Again, if the pain is so severe that it's causing your normal daily life to be affected, or when you're using over-the-counter painkillers, they're not touching it, something else is going on and you need to be investigated for that. And you know, that might be you having to be referred to your gynecologist, you might have to have some tests done, might be some bloods, but you really need to be checked out and you need to be looked after and make sure everything is okay for you. Also, like we discussed in the last video, when you have painful periods, you know, a hot water bottle, lavender pillows, you know, pillows that you can like put in the microwave. I've got a teddy bear that's got rice beads inside it, and I put the rice beads in the microwave, and I can use that when I've got like muscle aches and things like that, and that's really good. Again, a nice warm bath if you're someone that doesn't mind bathing when you're on your period, or even a nice warm shower. So guys, heavy periods do cause some people a lot of problems. Again, the flow of everyone's bleeding is completely different, but some women do experience very heavy periods, and this is a complication for them, and it can be really, really debilitating, I hope I said that right, for some women, because they literally are bleeding that heavily that they can't leave their house. If your period is that heavy and that it does affect your daily life and it does affect what you would normally do, you must see your GP, okay? What the GP can do is, again, some hormonal contraceptions can reduce your bleeding. There are medications out there that also can slow and reduce the bleeding. There are progesterone tablets that the GP can also give, and also they come under like the hormonal contraceptions as well. Depending on what the issue is, you may have to go for investigations. You may find that you've got fibroids, you may find that you've got endometriosis, and these are things that may lead to you having to have surgery. And this is why it's really important that you go and get it investigated. A good indication that you are actually suffering from heavy periods is when you're having to change your sanitary products every hour. You're passing blood clots that are larger than 2.5 centimetres, so that's roughly around the size of a 10p piece. You're flooding regularly, or you need to use 2 sanitary products. So what that means is that some women will use tampons as well as a sanitary pad. And if that is happening, then again, this is definitely a reason for you to go and have a chat with your GP. Irregular periods. So guys, again, this might be really normal for some people, and there is no reason why they have them, but they just do. Irregular periods are really common for people that are going through puberty, and also for people just before their menopause. Changing your method of contraception as well, and changing between hormonal, non-hormonal as well, can really cause problems with your period flow and can cause an irregular bleed. Things like extreme weight loss or a weight gain, excessive exercising or stress can also cause irregular periods. Medical conditions such as polycystic ovaries, but there are medical conditions that can cause you to have irregular periods, and I actually was put on a contraception pill to try and regulate my periods. So when would you need to see your GP if you were having irregular periods? So if this suddenly happens and you're under 45, then you definitely need to have a chat with your GP. If you have a period more often than every 21 days or less than every 35 days, then again, this is definitely something that you need to have a chat with your GP about. If there is a long difference, so there's a long gap basically, at least 20 days between your shortest and your longest menstrual cycle, again, have a chat with your GP. The irregular period could be cause a lot of distress for some people, especially when they're trying to fall pregnant. So it's really important that you always keep in touch with your GP if you're trying to fall pregnant and it hasn't happened. So stopped or missed periods. So there can be many reasons for this as well, and they can be pregnancy, stress, again, sudden weight loss or gain, over-exercising, and reaching menopause. If there is any chance that you could be pregnant, the very simple thing to do to understand why you've got a stopped or missed period is to do a test. That can answer a lot of your questions and alleviate a lot of your stress regarding why that's happened. If there's anything, you know, this is an ongoing thing, you are concerned, please reach out to your GP. That's what they're there to do. They're there to help you. This may lead to you having to be referred to a gynecologist, but this is something that we need to make sure that you're looking after yourself for. So guys, ovulation pain. I don't know if a lot of you know about this or a lot of you have heard about this, but what this is it's one-sided pain in the lower abdomen that happens when you ovulate. So it happens roughly about day 14 of your cycle, and this is getting your body ready to release an egg from the ovary, and as the ovary does this, it can cause some pain. The pain can be like a dull cramp, it can be a sharp sudden pain that just comes on. It can last for 5 minutes, or it can up to last for a couple of days. Some ladies will have also a small amount of vaginal bleeding when this actually happens. There isn't any real reason why it's so painful. It's just some ladies actually know when they ovulated, when they fell pregnant, you know, all from that process of being able to know their body really well. And like me, I haven't got a clue when I'm ovulating. I haven't got a clue when I fell pregnant until I did a pregnancy test. So yeah, some women are really in tune with their bodies and really know when this is going on. And a really good way of helping this type of pain, if it is a one that's going on for a couple of days or a longer period, is some over-the-counter basic painkillers. So guys, the last area that I'm going to touch on, and the reason that I left it till last is because I didn't want to confuse talking about periods. I'm actually going to talk about delayed periods now, and I think it's really interesting because people that haven't started their periods and might have questions about why they haven't. So as I said, a person usually starts their period by the age of 16 years of age. If you have had no signs of your period by then, you definitely need to have a chat with your GP. What I also found out though is if you haven't had any signs of puberty starting or any indications of puberty at all by the age of 14, again, you need to have a chat with your GP. They will send you off for some bloods, and they can do some hormonal blood tests to just check what your hormone levels are currently. There are some reasons that your period may not start, and they could be that there is actually a normal delay within your development, and this often happens and it runs within families. So if your mum or your sister was someone that started their period late, you may be in that same boat, and you may not, you know, start your period when your friends are. You may start it a little bit later. You may have an hormonal imbalance, and this is why it's really important to have some bloods carried out to check what your hormone levels are. Being underweight, and this can be coming from having eating disorders. This can delay a person's period. Doing lots of exercise, so really fit people like gymnasts, athletes, and dancers do sometimes experience delay with starting their periods, and that is there's lots of evidence of that out there. Severe stress also can cause hormonal imbalances and can cause us to have delays with things starting. So again, if this ever happens, just go and have a chat with your GP and just make sure that everything that is meant to be going on is going on, and if there are some things in the background that you know you need help with, that you get the right help with that. So guys, a delay in your period could come from you being pregnant. It is really possible that you can get pregnant before your period because your ovaries start releasing eggs a few months before your actual period starts. So bear that in mind. And there are conditions, like I said, polycystic ovaries, that can cause a delay within people's periods starting, and that will need investigation and referral to a gynecologist. So depending on, you know, the reason that this is happening depends on the treatment that you can have. Sometimes there is no treatment. Sometimes naturally Mother Nature will take her course and you will start your period when your body is ready to start. There are hormonal therapies if it's a hormonal imbalance. If there is issues regarding stress, said before, you may be referred to go and speak to a counsellor, have some cognitive behavioural therapy. If it's because you are someone that has an eating disorder, you know, you may already be working with a counsellor or someone that will be able to coach you through these things to try and safely maintain your weight and hopefully encourage your body to be able to go through puberty and also be able to start having periods. So guys, I end on a bit of a rubbish note really, but I am really hoping that you have learned something again. And like I keep saying to you, that's all these videos are for. They're just me trying to give you guys a little bit of support and guidance and help you understand what might be going on with your body or what might be going on with your young person's body. And if there has been anything that you want to talk about, if there's anything that you want me to talk about, please leave me comments below. Please let's make this really interesting. Let's make this an avenue where we can develop and grow together and make this really interesting. It's a safe place, guys. I just want to thank you all again for taking the time to watch my video. I hope, and I keep saying this, I hope you've learned something. I hope, you know, there's a little bit of information that you might have been able to take from this. I am gonna end this video now, and I am gonna see you in part 3, where you are going to hear me talk about my experience with talking to my big son about periods, and how I hope, you know, this has made him a better person. I think it has actually, but you're going to hear the story, and I hope that you have a little chuckle at some of the things that you hear. So guys, thank you so much for watching. All be safe, and I'll see you in part 3. Bye.